All right. We are doing a series of press conferences around the state related to vaccine hesitancy in the current COVID-19 vaccine. I'm Bob Sanborn. I'm president and CEO of Children at Risk and part of the Texas Family Leadership Council. And we have a great group of experts today to talk about this here in Bexar County. First up, Allison Winnike is with us. She is the president and CEO of the Immunization Partnership. Welcome, Allison. Also with us today is Elizabeth Lutz. She's the executive director of the Bexar County Collaborative. Nice to see you, Elizabeth. David McClendon is here. He's a principal and researcher with January Advisors. And then also with us is Dr. Robert Ferrer. He's a professor and vice chair for research with the Family Medicine Residency Program at UT Health San Antonio. Thank you all for being here. Across the state of Texas, we have about 29 million people living in Texas. 21 million of those people are eligible for the vaccine. As of today in Texas, we have received around 2 million vaccines that were necessary, and we've used about half of those. About 5% of the Texas population has had at least their first dose. The same is true in Bexar County. We're at about 5% of those that will be needing the vaccine. That still means, though, that 95% of us are still unprotected. And so it's a daunting task. And yet today, what we understand is we see these lines, we see people clamoring for the vaccine. The fact of the matter is that when surveyed, about 37% of the people in Bexar County said that they wanted to be part of that group clamoring for the vaccine. But what it also means is that over 60% of our population are either hesitant, somewhat hesitant, or very hesitant about getting this vaccine. Some are outright saying they don't want to take it. We need to make sure that after we've learned the lessons of the last month or so as people have lined up for the vaccine, what we understand is that there's still this significant group of people that are hesitant. And when you look at the numbers, it looks very inequitable in terms of who's getting the vaccine and who's not. We know as hesitancy plays into it, it's going to continue, equity is going to continue to be an issue. So when we look at this 37% group and that 60% that are hesitant, we look at, and we can break those down into specific numbers. We know that across the state of Texas, one of those hesitant groups is the African-American population. That may be changing, but we still see large numbers there. The Latino population still quite hesitant. New immigrants, undocumented immigrants are still quite hesitant about getting this vaccine. People in suburban areas still seem to be quite hesitant. But the area that a lot of us are most worried about are those without health insurance. Texas is the state with the largest percentage of our adults that do not have health insurance, the largest percentage of children that do not have health insurance. And it's that very group of adults that we become worried about, because if we don't get them vaccinated and we don't get these other groups vaccinated, it's very difficult for us to really conquer COVID-19. We have a plan in terms of doing this. And one is that the state really just needs to get its act together on making sure that we vaccinate those who, first of all, really want the vaccine. Secondly, we really need to figure out how are we going to message these hesitant populations. We need to do more focus groups. We need to do more surveys, much like we did during the census to figure out where people were. We need to do this around this vaccine population, this population that's hesitant to vaccine. Thirdly, we really need to develop an individual and unique message for those individual and unique communities that are expressing a little bit of hesitancy towards the vaccine. Right now, we see 5% out of 100% in the state of Texas that have taken the vaccine, and 37% that are interested in doing this. This is still not enough. We still have to get numbers near 60, 70, 80, possibly 90% before we get this herd immunity that's so important to conquering COVID-19. We really need to develop statewide policies, and we need politicians to leave politics out of this equation and focus on health, focus on science, and understand that we need to serve the entire state and the entire population in regards to distribution of the vaccine. We're all in this together. We've said it from the beginning. We don't always show it, but this is the time to show it because we see light at the end of this tunnel. And we've seen miracles in regards to the development of this vaccine. Let's use it so that we can get back to work and that we can get back to this vibrant economy that we have in Texas. And we're not going to return to that vibrant economy without us using and equitably this vaccine. It's very, very important. Let's now go to Allison Winnike. Allison, give us your take on the vaccine.
Well, one of the main issues is that many Texans have really lost trust in our public health officials and politicians during the pandemic because we've heard months of mixed messages from all levels of government, and it's confused the public, damaged credibility, and really allowed some fear and misinformation to spread. But it's important that folks understand that COVID-19 vaccines are the best tool we have to end this pandemic and return to life. They will save your life if you get a COVID-19 vaccine. You know, we have 2 vaccines so far, the Pfizer and Moderna vaccines. They are about 95% effective after receiving both doses. And what that means is that they are essentially 100% effective in preventing you from contracting serious case of coronavirus. But this is the thing that we're talking about numbers in Texas, is that American medical experts estimate that we will need at least 70% of Texans vaccinated against the coronavirus. But that number may be low, and we may need to get up to about 94% of Texans vaccinated just so we can end this pandemic and return to our lives. And that's when we have to look at the large groups of people that have questions about the vaccines because of the problems with trust, messaging, and even the frustrations with vaccine availability and distribution and access. And one of the things is there's been a lot of passing the buck. And unfortunately, it's our local communities that are paying the price. And that's why we really need to rely on local partners like the Immunization Partnership, Children at Risk, and our other partners in the San Antonio and Bexar County area to fill those gaps. What we need to do is assess communities that have high COVID-19 community vulnerability indexes, like social vulnerability and also high-risk populations. And we need local San Antonio foundations to help step up and support us so we can craft tailored messages to local residents who may have questions about the vaccine, because it's important that Bexar County and San Antonio area residents get trusted, accurate information about how getting a COVID-19 vaccine will save their lives and protect their family. And I would also really implore the Texas legislature to pass legislation during this session to build a more functional state immunization registry so we can track what's going on with the COVID-19 vaccines and look to ways we can reduce vaccine preventable diseases in congregate living areas, ways that we can improve vaccine access and equity, and also to support vaccine research and development. And, you know, every day at the Immunization Partnership, we're really fighting for Texans to make sure that you have access to a COVID-19 vaccine to protect yourself and your loved ones.
Thank you, Allison Winnike from the Immunization Partnership. Thank you very much, Allison. Next up, Elizabeth Lutz is with us. She's the Executive Director of the Bexar County Health Collaborative. Elizabeth, give us your take on what's going on.
So I think that, excuse me, we can learn a lot from the pandemic crisis and how, as a community, we responded to that need. There was a lot of need for collaboration. There was a lot of need for extension of services from one another. And I think that that's a real key part of this next phase in ensuring that people have the right access, the right information, the right resources to make some really good decisions about their family's health. I think definitely I agree that there was a lot of confusion, you know, from the standpoint that we are in as a community partner. I can tell you that there was a very earnest effort, and there has continued to be a very earnest effort to continue to collaborate amongst public health and community health officials, and also some of our nonprofits around Bexar County, to ensure that those most at risk were receiving the right information in the language and the resource type that was pertinent to them. Now, what we would ask is that there be more opportunities for us to focus on a prevention aspect, make sure that we have the right information and literature. And we're working on a wonderful project with Dr. Robert Ferrer, who I'm sure you'll hear about later, with regards to messaging, proper messaging, using and exercising our valuable community health workers, promotoras, navigators within those areas, to ensure that people are receiving information from the people that they trust, which are going to be people that live in those neighborhoods, that work in the jobs that they do, that could really help have conversations, right? And so how do we create that safe space to be able to ensure that people have that right access? I know most recently I had been talking to Dr. Anita Kurian with San Antonio Metro Health Department here, who's leading the effort around vaccine distribution and vaccines. I actually went to the Alamo Dome yesterday, where we are having massive distribution. And definitely, you know, there's some challenges from people trying to enter. There was an article this morning about people showing up at different locations trying to get access to extra vaccine. You know, but I have to say, we have to also recognize that our public health officials that are here, those that are working the lines, those that have been, you know, working on this issue in and out, I mean, exhaustive hours, are also doing the best they can to ensure that they're leveraging every single partner to help them communicate and to bridge those resources to people. There have been multiple issues, like people registering multiple ways and multiple times, and so then that causes a delay or uses up a spot for someone else. We saw the same thing happen when people were trying to get tested for COVID. I think that if we can, as a community, come together to address some of these issues, bring up some of these issues, and then try to identify solutions with community, with those families that are having this fear and at the same time hesitancy, with those that are showing up and saying, there's not enough and I need to be in the line and I need to put myself in multiple lines, explaining to them that further exacerbates the system, right? So I think that there's just different ways that we can really attack this, and it's going to take all of us to really come together to do it, not to work in silos, but to really offer support in different ways to be able to access those populations and provide them the resources that they need.
Thank you very much, Elizabeth. Elizabeth Lutz is with the Bexar County Health Collaborative. She's the executive director there. Next up, let's look a little bit at the research. David McClendon is here. He's a principal with January Advisors. And David, you've focused on some of this research. You have a few slides for us?
Yeah, thanks, Bob. Thanks for inviting me. I just want to underscore some of the data points that Bob talked about at the top. First off is just to say that according to a recent December poll by the Episcopal Health Foundation in Houston, it's a statewide poll of Texans, found that 1 in 5 Texans say they're very unlikely to get the vaccine. And as Bob said, only 37% said they're very likely to get the vaccine when it becomes available to them. This is still a large number, but it has been declining since the vaccine has come into and become more available. So in September, it was a little bit higher, and it's come down. It's come down particularly for Black Texans who are becoming less hesitant towards the vaccine. But there are many groups that are still very hesitant. Those with lower incomes, those with less education, younger adults are more hesitant about the vaccine than older adults. And as Bob mentioned, those without health insurance. And I think there's still a lot of research to be done around why are these groups hesitant? What are the barriers? There's probably different explanations for different kind of groups and different messages that those populations need to hear. I want to briefly give you an overview of vaccine hesitancy by county. So we took the statewide survey that Episcopal Health Foundation did, and we applied those age and income differences to the age and income profiles of different counties throughout Texas to generate these estimates. Again, Bexar County is pretty even with the state of Texas at 37%, but you can see the spread in terms of El Paso and Hidalgo slightly lower, more hesitant. Travis County, Tarrant County, or Travis County is a little bit higher than the state average. As of, I updated these numbers yesterday because the state is publishing vaccine, the number of vaccine doses that have been administered across the state every day, which you can get from their website. And more than 5% of Texans, so those 16 and older, have received at least one dose. In Bexar County, that's 86,000 folks, which means about 6% of those 16 and older had at least one dose. It's a bit higher in El Paso, but in Bexar, it's still much higher than places like Dallas, Tarrant, and Hidalgo. What we need and what this data underscores is that we need to use data to continue to track the scope of the challenges we face, to know which groups are hesitant and also why. And some of the why can inform the vaccine messaging that we need to use to reach hesitant groups. Or groups who may just not even be aware about and have all the information about why they should take the vaccine. We can also use data like we did during Census 2020 to identify trusted community voices in those neighborhoods where those populations live, who can deliver the messages and can be those trusted voices to win people over and increase awareness. We should also use data to ensure an equitable rollout of the vaccine, to ensure that people have equal access, rural communities, communities that don't have easy access to transit, so that we make sure that no one gets left behind. And finally, using data to evaluate the effectiveness of our outreach efforts, not just after the fact, but during a campaign rollout in real time to be able to correct course if needed. Finally, I want to say that the state has done a lot to make data publicly available. As I said, you can download the vaccine data daily at 4 p.m. is when they publish it. But there's more that can be done at the community level to ensure that we have all the data we need to make sure everyone gets the vaccine and stays healthy and safe. So I'll end there. Thank you very much, Bob.
Thank you, David. And then finally with us is Dr. Robert Ferrer. He's a professor and vice chair for research, family medicine residency program, UT Health San Antonio. Dr. Ferrer, you're sort of our cleanup hitter. Give us sort of the lowdown from your perspective as a physician.
All right, thank you, Bob. So my perspective on it is, boils down to a few points. So the virus is widespread. We know that. We've seen the national statistics. We've seen the local statistics. It's clear that it's very contagious. It's airborne. So if you're in a space with other people who may or may not be infected, you're at risk. The measures recommended to protect people, the masking, the social distancing, they work. But at this point, it's clear that they don't work at a high enough level to protect the population from the virus. They won't get us all the way to controlling the virus. It's also clear that there are high risk and there are low risk people, older adults, those with chronic diseases are at high risk. But it's also important to say the people in the low risk groups, the 30 and the 40-year-old, they shouldn't be complacent. We are seeing 30 and 40-year-old folks dying without chronic diseases who do succumb to the virus. And obviously that's a terrible tragedy to be cut short that way in the middle of your life. I worked in the hospital in July during the surge in the COVID ward. I'm starting another shift tomorrow. It won't all be COVID, but it'll be patients with COVID. And I can say as a provider who's taken care of a lot of people with a lot of different conditions, the virus is scary. It gets a hold of people and the recovery is very, very slow. It's very hard for older people to shake. And luckily more treatments are coming online, but it's still much better to be in a preventive situation than in a treatment situation as far as we're concerned. It's also clear that the virus is hitting economically disadvantaged communities very hard. I saw a spreadsheet on Wednesday that was shared in San Antonio. There are neighborhoods, zip codes in San Antonio where the rates are 16 times as high as they are in the least afflicted zip codes. So those disparities are very real and really awful at this point in terms of their impact on those communities. Now, the good news is, as several people have said, the vaccines are very effective. The Pfizer vaccine, the Moderna vaccine, they work, and the side effect profile is actually quite good. The main serious side effect is allergic reactions, but the CDC just came out with some data that happens 1 for every 100,000 injections. So unless you're someone who has to carry around a kit to treat anaphylaxis after a bee sting or after a food that you're allergic to, it looks like the safety profile is actually quite good. And the most important thing to say is that the vaccine is our way out of the pandemic. It's what's going to get us back to a normal way of life, and something that at least approaches more normal, hopefully in the summer and fall as more and more of our folks get it. The vaccine is free to all. That's part of the deal that was made with the manufacturers, and that's an important thing to understand as well. Right now, the distribution, as has been noted, is not matching the demand, but more vaccines are coming. And the later vaccines are actually going to be easier to store and deliver than the first two vaccines. So I'm working with a local team that's funded by the feds to understand the concerns in the different heavily afflicted communities in San Antonio. And we're meeting with various community groups to understand and address their concerns. And we're hearing a lot of the things that have already been discussed here about hesitancy, about misinformation, about fears about what's in the vaccine. But I think we can overcome those with good, solid messaging, respectful conversations with communities to understand and address what the issues are. So I think that's it. We're in the middle and locally and making the vaccines more available to disadvantaged communities with mobile kinds of delivery systems and more sites. And I'm very anxious to see those roll out. I'll stop there.
Dr. Ferrer, I want to ask you one question before Elizabeth and I say a few words in Spanish. And we know that in the state of Texas, despite all appearances where it seems like everything seems to be in a turmoil, Texas is vaccinating more than most any other state. We've certainly vaccinated in pure numbers more than any other state. So we're doing a relatively good job. But from your perspective, when you see this large group coming up, at some point we're going to be needing to vaccinate the 60% that's more hesitant. What's your biggest worry about that group that's hesitant?
That we don't overcome the fears and the misinformation, that we don't achieve a balance between people's concerns, but also their enthusiasm about what it's going to do in terms of protecting them, their family, their co-workers. Because that's the way we dig ourselves out of this hole that we're in. So just to trying to get that across and then sort of point by point understand what the concerns are and give folks the best information that we have available to help them decide.
Thank you very much, Dr. Ferrer. A few words in Spanish. Alguna palabra para la prensa latina. Elizabeth Lutz, quiero preguntarte, estamos preocupados con qué está pasando con un parte de nuestra población que es muy grande, que tienen preguntas sobre la vacuna. ¿Qué podemos hacer para que familias, especialmente en la comunidad latino, saben que es ok para usar esta vacuna?
Sí, es muy importante que la gente latina ponga atención a los mensajes que se les están dando. Y si por alguna razón los mensajes no son claros, no tienen información suficiente para hacer decisiones sobre obtener la vacuna o no, el local donde se están dando las vacunas, lo que es necesario traer con usted, con sí mismo, a esas estaciones donde están dando las vacunas. Es importante que usted dirija esas preguntas y sus cuestiones a los políticos y a los del Departamento de Salud. Más es que usted tiene oportunidad para darnos información sobre qué es lo que puede ayudar y cómo podemos poner programas o soluciones que de veras les esté dando el efectivo mensaje para obtener las vacunas y en dónde.
Thank you very much, Elizabeth. Muchísimas gracias. And thank you to everyone here for the work that we're doing. I know every one of you will be available to the press individually should they care to interview you, but thank you for all the work that you're doing, and thank you to the press. All right, we should be going off here in a second. Thank you all very, very much for everything you're doing. And hope to see you guys soon, right?
Yes, thank you guys so much.
All right, thank you.